Before we get started today, I want to acknowledge that we are all mourning the loss of a member of our community over the weekend. Later in today's presentation, our colleague from the Faculty and Staff Assistance Program will share resources to help cope during this challenging time. With that, we would like to observe a moment of silence to reflect on this loss that we have experienced. Please take a moment. Thank you all for taking that time. Now I'd like to turn it over to my colleague, Hallie Nicholson, to kick off our town hall.
Thank you very much, Terry. Well, welcome everyone. Again, it's great to be here with you for another one of our staff town halls. My name is Hallie Nicholson. I'm the HR Strategic Communication and Engagement Manager, and I'll be with you as your moderator for this town hall. So today we've got a group of panelists on hand to provide some updates about our operations during the COVID-19 pandemic and to answer your questions about things going on around campus. Some of the questions we received today were submitted during registration, and we're also accepting questions during our event today. So you can use the Q&A window at the bottom of your screens to submit additional questions for our panelists, which we will be answering both on screen and in writing. So please do use that feature. Due to our time limitation, we won't be able to get to all of our questions, but we will log the questions as they come in and post answers on the Return to Learn website. So before we get started with our presentations, I wanted to make sure that you're aware that this webinar has live closed captioning available in two ways. First, you can click on the closed caption button that's at the bottom of your screen, and you can select show subtitles, or you could also click on the link that will be pasted into the chat momentarily. So with that, I'm going to kick it back to our first presenter, my colleague Terry Winbush, our Senior Director of Labor Relations and Employee Relations, to share some updates about human resources.
Thank you, Hallie. So hello again, everyone. We just wanted to share some updates to make sure you're all up to date on all the things that are going on from a human resources perspective. So the first thing I think everybody wants to know about this is when or if we were having winter curtailment. Yes, we are. So our winter curtailment is scheduled for Thursday, December 23rd through Friday, December 31st. What that means is they're the university paid holidays on December 23rd and 24th, and on December 30th and 31st. And then so for the days of December 27th, 28th, and 29th, those are the days where you will use either your vacation time, your comp time, and if you're a new enough employee or for reasons otherwise don't have vacation accruals to use, you can actually borrow against your upcoming vacation time and go into the negative for the 3 days to cover and have full pay during that time. And this is something that can only occur during a curtailment. So if you need to, please do so that you can have your full pay. Now, many people ask this, and this has come up even recently, well, why are we having a curtailment if so many people are working off site? And I will just say what I said last year when this came up. It is imperative that at least for those of us where our operations truly can curtail, because like our health colleagues don't necessarily curtail operations in the same way. But on the campus side, it is imperative that people take this time to rest and recharge, to not be sending those emails, for others to not be receiving those emails, to actually take a time to step away from the computer screen or maybe all the screens rest and recharge so that you can gear back up for the new year. So please take this time and do something that brings you joy. The other thing that people have been wondering about is, will there be a flu vaccine requirement? And as the notices are going to be going out today, there is a flu vaccine requirement. However, we have tried to make it as easy as possible to engage with that process. So you will go to the link provided in the campus notice or on our flu vaccine page on Blink. And on that link, it will take you to the ServiceNow page where you can read some information that's helpful. And then you can log whether or not you have your flu vaccine already, or if you are declining to get a flu vaccine, and there's no additional information required. If you haven't made the decision, or you've made the decision to get your flu vaccine, but you haven't actually done it yet, your appointment is coming up this weekend or next week or something like that, please know that A, your deadline to comply with the flu vaccine requirement is November 19th. And B, don't log on to that page to document which way you're going until you've completed that. So if you can do that, you look for that campus notice that'll be coming out, and we'll be providing additional information as well to make sure that you engage with that. Many of you have experienced some fun or not so fun hiccups related to the symptom and exposure screening update. I lovingly have called it red thumb gate, where a number of individuals are getting red thumbs that they're not accustomed to receiving. Some of it is related to some technical challenges that we're working through. Some of it is related to testing. A lot of people have not realized that they have a testing requirement as it relates to being on site. And so if someone is either unvaccinated and not complying with the policy for the COVID vaccine mandate, they are still supposed to be testing as a requirement to be on site. And that testing policy talks about testing twice weekly, every 3 to 5 days. Some of that is adjusted for folks who work on site less frequently than that. So work with your local HR contact on those requirements. For those who have exemptions or deferrals through the Cedric process, understand that you also are supposed to be testing as part of your exemption or deferral. I want to say this in case we have any student employees who have joined us on this town hall. Students, you should go through the student process. Do not go through the employee login, or don't use your employee login for the symptom screener or things like that, because those won't interface with your student data on your vaccine status, and it'll cause confusion. It'll give you a red thumb when you don't need it. So make sure if you're a student employee, you are signing up through your student process and registering through your student process for the symptom and exposure screening. More details have been sent out to HR contacts to distribute and make sure that employees are aware, but we wanted to make sure you all knew this. And lastly, the thing that we really need to be thinking about as we go towards the end of this calendar year is to really stop and reflect and take time out to give thanks to those who we work with, we work for, who work for us, to not always think about ways to keep them into compliance or whatever, but also just to recognize that a lot of people are doing a lot and we are often asking them to do more. So taking time to stop and just thank them for the great things they have been doing, how they've been showing up over all of this time, take that moment and thank them. Thank them individually, thank them in groups, thank them in public. And we'll be providing some other means to thank folks publicly in the coming months. So stay tuned on that, but really take that time to reflect on that. And then think about everything that you've been doing and show yourself some grace. Again, we've all been lifting a lot. On the screen, you see more requirements that you have to pay attention to. And this comes at a cost, and it comes at a cost of energy and sometimes well-being. And so take time for yourself and think of this as a good opportunity to reflect on that as well. So with that, I will turn it back over to Hallie for our additional presenters.
Always a great reminder. Thank you so much, Terry. The next I'd like to introduce my HR colleague, our senior benefits analyst, Stacy Smith, and Stacy's going to share some information with us about open enrollment, which is coming right up. So Stacy, take it away.
Thank you, Hallie, and good afternoon, everyone. And this is the open enrollment season. This is your annual opportunity to review and make changes to your benefit selection. This year's open enrollment will begin tomorrow, October 28th, and will close on November 19th at 5 p.m. And I'm saying 5 p.m. because it's a strict deadline. During the open enrollment period, you'll be able to make changes once per day. So be sure to go in and make whatever changes you need to make, but please submit by November 19th at 5 p.m. Pacific Standard Time. So changes that can be made during open enrollment. You may add, change, or drop health plans. So your medical, dental, vision. You can drop qualified dependents, ARIG legal, supplemental health plans, flexible spending accounts. A note on flexible spending account, you must actively re-enroll in the flexible spending account each year. If you do not actively enroll, you will not have the coverage for the upcoming year if you intended to have it. So be sure to re-enroll each year or this year if you'd like to have it. You may not make changes to voluntary disability and supplemental life insurance. These plans are available year-long. And if you've missed your opportunity as a new hire to sign up for these plans, you would need to support your eligibility by completing an evidence of insurability and working with the vendors to get an approval before you can sign up. Next slide, please. How to explore options during open enrollment. So you're wondering, well, how do I know what changes are coming and what can I do to prepare myself and learn more? So you can attend a live UC Path webinar to find out what changes are coming this year. These webinars are the time or registration for these webinars can be done through UCNet, and there's also going to be a link page where you can go to find that link, and it's just been posted in the chat. You can watch presentations and review information from our benefit providers based on your interest. So based on whatever you're interested in. We also will have live presentations from our providers, and those will be held on November 3rd. So that's next week. They will be presenting information about the plans and also be sticking around to answer questions live. So please try to attend some of those sessions. If you still have questions, attend one of our benefits open enrollment office hours. These office hours will be hosted by campus and health. So we're combining efforts to support everyone. And so attend one of those sessions. If you still have questions and you didn't have a chance to attend an office hour session, contact the open enrollment service desk at hr@ucsd.edu. This is new for this year, and we hope that you will utilize this service if you still have questions. And finally, make your elections in UC Path. And again, this starts tomorrow at 8 a.m. Don't forget, if you don't have anything that you want to change, that's okay. Still go into the website and take a look at the plans that you have. Make sure everything looks good. Make sure your dependents are there who you want to have on your plans. And once you make your elections, you will get a confirmation email. Make sure you receive it. If you don't receive it, it means you didn't do something right. Once the open enrollment session closes, you will receive a final confirmation statement. Please review that as well to make sure that you have everything that you want. And that's it for my presentation, and I'll send it back to Hallie. Thank you.
All right, thank you so much, Stacy. And as Stacy mentioned, I just want to share with all of you, you can expect to receive a campus notice tomorrow that has some of these instructions, the links, the information about the service desk, a link to UC Path. So keep an eye out in your email for that tomorrow, and then also throughout open enrollment with some reminders, knowing it's such an important period. So speaking of exploring your options about open enrollment, I'd now like to introduce Michael Rufo, Director of the Physician Network, who's going to share some information about one of your open enrollment options, which is UC San Diego Health. So Michael, take it away.
Thanks so much, Hallie, and thank you everybody for having me this afternoon. As they mentioned, I just want to follow up on the open enrollment items to talk about what UC San Diego Health has really been focused on the past 4 years, and that is increasing the number of primary care providers that we have in the community. Over the years, UC has really been viewed more as a specialty or ancillary kind of provider, but we really want to take care more of the population, more of the general public, and more of our employees. So again, thank you for having me. This site here, this slide here shows our map of sites. You can see the yellow dots on the right there. These are some of our newest sites, Rancho Bernardo, Encinitas, Pacific Highlands Ranch, and Eastlake. These are beautiful sites. There are new primary care doctors here with lots of access, which tends to be a new thing for us. So it's actually easy to get in and get your first appointment with our doctors. And then I want to point out all the blue dots there on the right. This is our physician network. So these are independent practices in the community, not owned by UCSD, but partnered with us. So we contract with these providers and they accept our health plans. So as you're looking at open enrollment, Blue and Gold is one of those plans that most of these providers accept. And I will talk a little bit more about those affiliates in a couple of slides. Go ahead, Hallie, next slide. So what I want to point out is that UCSD uses an electronic medical record. It's called Epic. And Epic is a state-of-the-art platform. It uses this item called MyChart. This is either a phone app or a web-based platform where you can log in and you can do all these things that you see on the right here. It's truly a fantastic piece of technology. You can manage your appointments. You can conduct video visits on this. You can message your providers, do prescription management, e-check-in, all these things. It's really a great way to connect and a great way to make your healthcare, accessing your healthcare a little bit easier. Go ahead, next slide. For those of you that do choose Blue and Gold, this is a plan that we manage here in our department for the health system. We have a new dedicated member center. The phone number is listed here as well as our customer service email. This member center can do absolutely everything and anything for you. On the left there, we talk about sort of our concierge level of service, especially for our employees. We can help with step-by-step assistance from transitioning of care, whether you're considering changing from Kaiser or Sharp over to UCSD. We can help you select an appropriate primary care provider and access specialty services as needed. But claims, authorizations, referrals, all that stuff, this member center is the one-stop shop for any of those items. Next slide. So here's the first of our affiliates that I want to mention. So this is One Medical. This is a concierge style practice. They actually charge a fee annually of $200, but as UC employees, we waive this fee for you. UC pays this fee for all of our employees to join One Medical if you're interested. They've got 3 locations in downtown La Jolla and Carlsbad. They have longer appointment times. They offer their own app with 24/7 physician contact access where you can just hop on a video visit with a doctor that's available. Truly fantastic practice, one to look into. Again, you can choose One Medical as your primary care provider or UC San Diego Health, our own PCPs. And you get to use all of our fantastic specialties and hospital services if you choose these groups. Go ahead, next slide, Hallie. Here's our second group that I want to call out. This is the Perlman Clinic. They have 16 locations across the county, so truly easy to access this group. The best part about the Perlman Clinic is they also use Epic. So when we need to exchange your medical records between specialty care providers and primary care, they're already on our system. They have all the records that you need. And if you have to come here for specialty services, we'll have all those records as well. They also use MyChart. So any group that's on Epic uses MyChart, which is fantastic. Next slide. And the last group I want to call out is San Diego Sports Medicine. This is a group that's been in our network for a long time and been in the community for a very long time. They've got 4 sites in Liberty Station, Pacific Beach, Sorrento Valley, and close to Alvarado Hospital. Fantastic group, also on Epic. They have patients of all ages. So again, if you have got little ones, both Perlman Clinic, One Medical, and San Diego Sports Med all see pediatric patients. But any of these practices that I'm mentioning, you can choose primary care docs at these clinics, and again, have access to UCSD for specialty and hospital care. I think just the last slide here. For anybody that is considering switching, we've made this very easy. Once you select your plan, again, look at your benefits that we have available to us. Blue and Gold is one of those plans that we accept. Once you select your plan, you need to choose a physician and transition your records. And the nice thing here on the right side of this slide, this can all be done through MyChart, where you set up your MyChart account and we can pull your records from whatever system you've been with, and we can help you with that member center, choosing your doc, etc. So thank you all very much.
All right, thank you so much, Michael, for all that information. That was great to learn so much about UC San Diego Health, which is a great resource to us. So next up, changing gears, I'd like to introduce my HR colleague, Vim Iglesia. He's a recruiter with our Temporary Employment Services unit, and Vim's going to share some information about how to refer folks for opportunities with TES. So Vim, take it away.
Hi, everyone. My name is Vim Iglesia, and I'm one of the recruiters here that supports UC San Diego's Temporary Employment Services Department. If you haven't heard of our team is responsible for hiring temporary staff for the medical centers, health sciences department, and campus divisions of the university. When a department reaches out to us, it's typically to provide coverage during interim periods of recruiting, vacations, medical leaves, or special projects. Our team provides critical support staff to help maintain operations in multiple departments across the university. You may be asking yourself today, why are you seeing a recruiter in a town hall targeted to faculty, staff, and students? I'm sure that many of you have seen on the news or experienced in your own departments that we're experiencing a staffing shortage in all industries. To give you a brief look into our world, our team has received over 50 requests for temporary employees in the last 2 weeks. While we can and are posting jobs online and sourcing candidates through LinkedIn and Indeed, we've learned that our best source of candidates are employee referrals and word of mouth. That's why I'm here speaking to you today. I'm here to ask you if you know someone who wants to work at the university. If you do, I want to provide you with 3 talking points that you can share with your network and community. So number 1, we have options. Our team hires positions at every level, from food service workers and custodians to executive assistants and admin professionals for the campus and health systems. We can't hire current UCSD students or employees into these roles, but recent grads are definitely encouraged to apply. If you know someone who is open to temporary work, we have a position available for all levels of experience. Number 2, experience. Working with TES is a great way to help someone gain experience working at the university and get their foot in the door for career positions. While I can't guarantee every TES employee is hired into a career role, I do want to share some numbers. Between January and August 2021, 133 TES employees were hired into career roles. Number 3, benefits and assignment length. Temporary employees are eligible for health insurance plans, vacation, sick, and holiday pay. We also set them up with a defined contribution retirement account. Additionally, employees can expect to be on assignment up to 6 months. Most of our jobs are full-time positions, but part-time positions are also available. This is a great opportunity to see what it's like to work as a university employee. If you're hearing this information and thinking to yourself, hey, I know someone who'd be a perfect fit to work with TES, I want to make sure that you have the resources you need to get them connected to us. We've created a flyer for you to share with your network, but feel free to direct others to our website at temp.ucsd.edu or have them contact us directly with the email on the screen. We're happy to connect with your referrals and find them an assignment at the university. I think that's my time. I'll send it back to Hallie.
All right, Vim, thank you so much. That was great information about how we might be able to share with neighbors or family members. So really great information. All right, so next up, I'd like to welcome an HR colleague, FSAP Counselor Brian McNutt, and Brian's going to share some updates with us about some offerings of our faculty and staff assistance program. So Brian, handing it over to you.
Thanks, Hallie, so much, and good afternoon, everybody. It's a pleasure to join you for the staff town hall meeting today. I'd like to take just a few moments to highlight some of the virtual group-based offerings that the Faculty and Staff Assistance Program is going to be providing over the upcoming months. As many of you probably already know, FSAP is your in-house employee assistance program. And there's several types of services that we provide in an effort to help support the emotional health throughout the campus community. We offer confidential individual counseling, management consultations, as well as departmental team-based support. And another one of the areas of service that we offer to employees are group-based services. And these include a range of different types of group formats, including conventional types of support groups, as well as educational workshops that are really focused on mental health needs and emotional health needs and concerns. So I want to highlight a couple of the upcoming groups that we have that will be beginning in the next couple of months. We have a new mindfulness meditation group, which I will be facilitating, that we are calling Mindful Pause. And this is going to be a monthly group meeting that really focuses on utilizing practical approaches of mindfulness-based skills that we can use in our daily lives as well as our working life. It's going to be an experiential group, and the sessions will have some guided meditation exercises. And the hope is that these can be some exercises and skills that you can use to integrate in your daily life, your working life, just to help promote a little bit more emotional calm and focus and presence. Another group that we have upcoming is going to be an introductory discussion about a grief support group. As was noted at the top of the town hall, there are many types of losses that folks are experiencing these days. And we certainly know that this has been a long season of change and adjustment and loss for many folks. And of course, whenever there's an experience of change, there's an experience of loss. And sometimes we do feel a grief reaction with these kinds of changes. So we're going to be offering an introductory grief support group discussion that is likely going to meet in early December. And this is going to be an introductory discussion about grief and loss, but we're also going to use that time to help clarify what staff really feels would be beneficial for them, especially surrounding changes and losses. We're going to take feedback from that session and use it as an opportunity to really structure a grief support group that will be most beneficial and meaningful for campus employees. I'll also just take a moment to highlight all the current ongoing support groups that we have that focus on a number of common areas of life stress that many employees experience, such as the ongoing challenges of being a working parent or caring for a loved one in your life. We have the monthly groups that meet for working moms as well as working parents. We have the caregivers and elder care support group. And we also have the monthly Triton's Flourish group, which I know many campus employees have attended at some point. Triton's Flourish group is really an opportunity to come together for community support and finding ways to really build more positive engagement with your emotional life. So thank you for your engagement with our program. Please know that we are here for you to support your emotional health needs as you continue to engage in your responsibilities and work at UCSD. And be sure to check out our calendar for groups that we have listed. You can find our website, at least our webpage, through the Blink search engine. And you can find more information about each group, as well as the contact information for the facilitators and appropriate registration links. So thank you again. I'll turn it back to you, Hallie.
Thank you very much, Brian. Always a good reminder to remember all the resources that we have available to us through FSAP. So for our next presentation, at our town halls, it's important we want to look at all different areas of campus and get updates about some, different things that are going on. So today, I'd like to introduce our next presenters, Patty Mahaffey, Assistant Vice Chancellor for Student Life. And then later, we'll also be hearing from Maruth Figueroa, who's our Assistant Vice Chancellor for Student Retention and Success. So Patty, handing it over to you.
And I'll be happy to start my video. Oh, there we go. All right. Thank you so much, Hallie. So good afternoon, everybody. Patty Mahaffey, AVC for Student Life. And our Triton Weeks of Welcome this year were very successful. We really saw a record turnouts of our students to all of our traditional events, which was wonderful to see and to have that energy back on campus again. Convocation on Olympics, Meet the Beach, Triton Fest, just wildly successful, which was really wonderful. Especially some long lines for tabling that we did, and especially for any of the giveaways that we had. Our athletic events really busted through expectations for attendance. And our students are here and they are getting involved in their colleges and all throughout campus. Our student organization registrations are also up, and our sorority and fraternity life have seen high attendance during recruitment. And excitingly this year, the campus formally recognized the National Panhellenic Council as one of the 4 main SFL councils on campus, which really elevates the presence of the Divine Nine organizations and provides critical support for our Black students. And if you want to go to the next slide. We also saw some strong AS recruitment during their recruitment week. And you might have also seen some lawn chairs out on Matthews Quad and also on the biomedical lawn. This is a University Centers project. It also includes lawn games, really focused on supporting students' social engagement and connection safely outdoors. And staff can use them as well. And our Basic Needs has also done a really phenomenal job this year, reaching out to students and supporting our students. We've seen a record number of CalFresh applications by students, which when approved can be a maximum food benefit of $250 a month, which is really beneficial to our students. We've also really had a robust food recovery program on campus that's done really well, sourcing food from places like Bristol Farms, local farmers markets, Bonds, and our HDH partners as well. So I'm going to turn things over now to Dr. Maruth Figueroa, who serves as our Assistant Vice Chancellor for Student Success and Retention.
So we've certainly experienced lots of successes. And as we navigate the return to campus in hybrid, we've also experienced some challenges. So up on the screen, you see a few of the challenges. Of course, we probably all have experienced some Wi-Fi issues. And our students are also sharing with us that they are encountering limited outdoor spaces that have plug-in access. And we've also heard from students with regards to needing spaces to work on their academic work, but additionally also our student staff who may be having some remote hours as well. Currently, there is a work group that is looking at the current spaces and drafting up some recommendations that hopefully will assist in identifying some additional spaces, but additionally also providing better ways to communicate that with the campus community. We've also had some, experience some additional costs in outfitting some of our outdoor spaces for events. To ensure that we are following all of the safety and health guidelines. We've also heard from students that the housing market has been definitely high in pricing and low in inventory. And I know that my colleagues, our colleagues in HDH and off-campus housing have facilitated webinars and have updated their websites with resources to help provide short and long-term solutions for that. And of course, our staff, as well as our students, are learning to navigate hybrid work. And this also includes caretaking responsibilities. We're having to adjust schedules depending on, sometimes kiddos having to be sent back, or ensuring that we are also available to take care of family members in the household. Next slide. During this time, we continue to focus on the health and well-being of our students. And on this slide, you see some programs that are available through CAPS and health promotions. And I'd like to share 2 that are not listed on here, and I'll go ahead and drop in the links in the chat. Triton's Rise Together, is a program that partners with CAPS and innovative and experiential programming that is based on research for peak performance psychology, mind-body science in the field of positive psychology. The workshops that Triton Rise puts together the goal is to enable students or individuals to reach their full potential in life, and this includes emotional, physical, and social. The workshops do not require registration unless it's indicated on the site, and I'll go ahead and drop that off. We've also heard that there's it's a huge need, an increasing need in nutritional counseling. And so during the academic year, nutrition counseling is provided by our registered dietitians, and the service includes computerized assessment and our nutritional requirements and follow-up visits as needed. There is no fee for registered students with UC SHIP and students with RAFT, but there may be some costs associated for students that are not part of these particular programs, and there is a cost outline on the websites that I will drop in the chat. Thank you all, and I'll turn it back to Hallie.
Great, thank you so much, Ruth and Patty. Always good to just kind of get a lay of the land and a sense of what's going on your side of the house. So for our final presentation before we move into Q&A, I'd now like to welcome Dr. Chip Schooley, Professor of Medicine, and Chip will give us an update on the state of the pandemic, vaccines, boosters, all that good stuff. So Chip, handing it over to you.
Thanks very much, Hallie. It's great to be with everybody today and to hear all the progress we've been having over the course of the last couple of months, and to be off to such a great start this year in terms of getting our students and faculty and staff back to a more university-like setting. I'll give a brief update, and I'll do it relatively quickly so we'll have time for questions and answers. I think as everyone on this call knows, things are going the right direction in the U.S. overall, with an ongoing decline in cases that had peaked mid to late August, but since that time have essentially halved in terms of their frequency. Next. The cases are shifting to the north. The places that were hottest for a while in the spring and in the fall, early fall, were down in the Southeastern Conference area, Alabama, Mississippi, places where vaccine penetration had been low. Things are shifting now to the north. People are concerned that this might be because colder weather is bringing people indoors. But the other issue is the states that are represented here are also states in which vaccine penetration is extremely low, and the two may be conspiring. So although this is a concern, I don't think we're going to see this kind of a surge in California, although we all have to still remain vigilant. Next. Pediatric cases have halved as well since school opened, and more schools put students in class with masks on and took advantage of what we learned about how to deal with adults. And we're in a very good situation now overall with the way schools are going in most parts of the US, and especially here in San Diego County. Next slide. County epidemiology is also good. Up in the upper left, you'll see that the number of cases is down in the 300 to 400 a day range, down from bumping 1,000 or so at the peak in the late summer. Hospitalizations are also down. And in the lower right, what you can see is that at UC San Diego Health, we're seeing an ongoing decline in cases. We only have 25 people in the hospital late last week. We have 21 today. And late last week, of the 10 people who were in the ICU, only one of them was fully vaccinated. And today we have 7 in the ICU and none of them are fully vaccinated. So it gives you an idea about how these vaccines are working to both keep people out of the hospital and also to prevent serious illness, ICU admission, and death. Next. These are just San Diego statistics, giving you an idea about how things are doing with it from the perspective of employees. Our employees are doing extremely well with test positivity rates of about 0.5%, which is only 20% of what we're seeing in the county as a whole, and students are down at the range of 0.15% with very, very good trends. So again, things are going very, very well on campus. Next. And this shows you a typical daily dashboard. You can see on the upper left, 0, 0, 0 on this particular day. No students on campus, no students off campus, and no campus employees and a couple of health employees. This is kind of what we're seeing, which I think is extremely good, with very good contact tracing metrics on the right. Next. And finally, just again, another way to look at this in the middle panel, if you look at the histogram, each of the bars is a day. The dark bars are student cases on campus, light bar student cases off campus. You can see that we're having a case every day or two on average with on-campus students, a couple more than that with off-campus students, but by and large, a very quiet situation with most of the cases that we see even in our on-campus students, we believe, being acquired off campus. On the right is the experience with employees, very, very quiet with employees. And for that, we really appreciate all of your assiduous attention. Next. To shift to vaccines, we're making great headway on vaccination. Students are now over 95%. Angela Soshan, the Student Health Service, and all the people working with that have done a great job at dealing with the vaccine mandate. The health system is about at the same level, and things are moving up rapidly on campus. San Diego County remains one of the most vaccinated counties in the country, with at least 89.7% of people over the age of 12 having received at least their first vaccination. Next slide. Now, to see where we are now with vaccines, there's been a lot of progress over the last couple of weeks. You've heard a lot about the booster shots. We're now mandating booster shots of our employees. We're just working really on the primary vaccinations, but the FDA and CDC have authorized boosters for several different groups of people. Anyone who's immunocompromised, whether you receive the vaccines from Pfizer, Moderna, or J&J, the recommendations are that you should be boosted. I'm talking about people who have transplants, people who are on immunosuppressive drugs, and so forth. People who are over the age of 65 or at high risk for disease, and this includes underlying conditions like more obesity, heart disease, and so forth. Recommendations are that those folks should receive boosters as well. And high-risk disease also includes people under 65 who are exposed, who have an occupational exposure that might put them at greater risk. And this would include healthcare workers and educational workers. And in California, people in higher education are included in that. And then finally, we have approval at the FDA and CDC for vaccination for children above the age of 12 to 16 with the Pfizer vaccine. And earlier this week, actually yesterday, children 5 to 11 with the Pfizer vaccine were approved at the FDA. The CDC will take it up next week. Things are moving along with the Moderna vaccine. I think they'll catch up soon in the next week or so, the next month or so. Anyone who's received the J&J vaccine, in my view, should receive a booster shot now, regardless of their underlying health and condition. And this has been authorized by the FDA and the CDC. So I will stop there and turn this back over to Hallie and colleagues.
All right, thank you very much, Chip. So with that, that was our final presentation. So I'd now like to invite all of our panelists who are going to be answering questions during our Q&A period to turn on your cameras and your audio and join me on camera. As a reminder to folks, the questions that I'm going to be asking, some of them were submitted in advance of the event. We're also taking questions during the event through the Q&A box. So I do encourage you to check that out. If you look at the answered questions, you might just see something you needed to know on there already answered in writing. So let's see. So we got this question coming in a kind of couple different formats. So I'm going to throw it out to the group. I wonder, Angela, Chip, if you want to start, maybe Terry follow up. So the question is essentially, what needs to happen with the pandemic for us to eventually be able to work inside without masks?
We're getting closer and closer to that as we speak. We're learning that people who have been vaccinated, the breakthrough infections, while they occur, are generally relatively mild. As people are boosted, we think the breakthrough infection will be occurring less and less frequently. And so although we've had a number of cases on campus, there has been very little in the way of morbidity for people who have been vaccinated. So we're evaluating this on a continuous basis. As you saw, we've relaxed quite a bit the eating situation for people at work stations, and we're going to be continuing to evaluate everything from masking at work to events and things that as we get more and more back to normal. We're definitely moving in the right direction.
Any other thoughts? I think that was pretty much summed it up. So it's great to hear that things are moving in the right direction. And to me, I also hear that as a reminder to just please continue reading your emails, attending these events. We are, these guidelines are changing, and they're changing because we want them to be up to date with the most current situation. So please do make an effort to keep up with kind of the guidelines as they change. All right. Terry, this question is for you. What will happen to staff who do not comply with the COVID vaccine mandate?
You know, I hate the question, not from you, Hallie, obviously, but the fact that there are some folks who don't want to comply because there are so many opportunities for compliance. If they are fully vaccinated, they share their consent. If they are not, they submit an exemption or deferral, and they provide the information required, and then they test every 3 to 5 days as part of their approved exemption or while they're pending getting exemption. And so we're doing everything we can not to take adverse action. But unfortunately, there will be a small population of folks who we will have to engage the disciplinary process. And that will be starting in the next couple of weeks for a number of employees. And so they could face a written warning. They could then face a suspension without pay, and they could ultimately be terminated. That is not where we want to go. As I've been saying, you know, all along on this process, we are doing everything we can to help get everyone in compliance, because that's the key. The key is the safety component of the mandate, not the compliance, you know, sort of heavy hand on the backside of the policy. That's not where we want to go. It's not fun for anybody to have to go through that. And I know some people are struggling with that, but it's really truly about the safety of the community. And, you know, I'm really heartened to hear the information from Chip. I also feel like I've gone to medical school like each month. I don't know if everybody else feels that, but the key is to continue with the vaccination. Like now we can get the 5 to 11-year-olds vaccinated. I'll be standing outside of wherever they're going to provide it for my kids to get them vaccinated. And so the more we can do that, the better off things will be. And the quicker we can get to a place of unmasking indoors and it being safe. But, you know, ultimately people may have to be removed from work if they're not complying, and that's where it may land.
All right. Thank you, Terry. Angela, question for you. We got several questions related to kind of our guidelines right now. So this person wants to know, what are the social distancing requirements for office spaces?
There's no specific social distancing requirement in terms of office spaces. The contact tracing is still using the 15 feet for an exposure distance. There's not been a change on that for the CDC. But we've not restructured everything to create, 6 feet, excuse me, I said 15 minutes, sorry, it's 6 feet. Apologize for that. So we've not structured everything to make everybody be at least 6 feet apart. So there's a little lag in the recommendations there. Okay.
All right, thank you, Angela. Okay, Chip, this question's for you. This person says, how do we respond to unvaccinated people saying, why bother getting vaccinated when there are breakthrough cases? So why bother getting vaccinated when there are breakthrough cases? What's the response to that?
First of all, the breakthrough cases, we're learning a lot about in terms of their risk to other people. People shed less amounts of virus for a much shorter period of time. They're much less likely to get infected themselves. And so it's like putting a wet blanket on a forest fire. The more people who are vaccinated, the harder it is for the virus to get around the population. In addition, people who are immunocompromised, people who have underlying conditions, people for whom the vaccines don't work as well because of their underlying status, we need to think about them. And people who are unvaccinated pose a much greater risk to them than people who are vaccinated. And these people don't have any choice. If you've had a renal transplant, if you have lymphoma or out in the population, you're a sitting duck for this virus. And I think we all need to think about those sorts of people when we try to make our own vaccine decisions. It's both for us and for them and for people in our own family.
Wise advice. Thank you, Chip. I'm going to send this next question over to Michael. I see it came in the Q&A, and I just thought it was maybe worth elevating to this portion. So the question that came in through the Q&A box is, several of the external clinics that you noted urgent care. So is urgent care available no matter what group you choose? Thinking of, I think it was Perlman, One Medical, all that. How does urgent care work for those groups?
Yeah, and that's a great question. So both Perlman and San Diego Sports Medicine offer urgent care urgent care centers or express care, somehow what we call it here at UCSD as well. Regardless of your insurance, you can utilize those services. If, for example, you are a blue and gold patient and you've chosen a Perlman PCP, you can still use that site, or an SDSM PCP. You can still use those sites for urgent care needs as well.
All right, thank you. Okay, here's a question as it relates to kind of students. So I'd say more Maruth or Patty, whoever maybe wants to take this one. It's a challenging time as we return to in-person experiences. So what concerns are we hearing in our student population and how are we addressing them? It sounds like they're really interested and, you know, group involvement's getting up, but maybe what are we hearing in terms of concerns of this kind of readjustment to all this in-person activity?
Yeah, Hallie, I'll take that question. There's, you know, if students are being, you know, they're being very engaged on campus, they're being very active, the energy's high. But yes, there's lots of concerns among our students and they're dealing with wide-ranging issues from being back on campus while still navigating being in this pandemic. And then there's the echo pandemic and what does that mean for mental health concerns? Students have been navigating housing issues on our campus and off campus. Students who are impacted by the weekend's tragedy. We have I think the bottom line is we have a lot of resources on campus for our students. I want to call out recreation for really stepping up this past like 18 months and providing some critical support and release for our students, and student health promotions that does a really great job of educating and then also providing things like therapy fluffies on campus. Basic needs and CAPS, you know, we've talked about some of those resources today already. I think if folks are not sure, connecting a student with their Dean of Student Affairs is really an important step. Just to reach out and learn about what's available on campus. This is a huge campus and there's lots of resources. And our goal is to help support our students and when necessary to just coordinate amongst all our resources to wrap around students in need and help support them. So I just say reach out, get some, you know, information about what's available on campus through these webinars and through the Deans of Student Affairs and other student affairs folks on campus.
All right, thank you. Good reminder of where to point students, it sounds like, kind of to their Dean of Student Affairs if they're looking for those connections. So that's a good reminder for our staff audience today.
Right, and also for the Assistant Dean of Students in the graduate division, for graduate students.
Oh, great. Good distinction to draw there. So next question, maybe Terry, maybe Angela. This person wants to know, what do you forecast at this point for masking mandates and meeting requirements on campus for winter 2022? Or is it looking like it's going to be the same as fall 2021?
I think we'll be starting out winter masked indoors for meetings. I think a couple things have to happen. We're going to go through a holiday period. There'll be a lot of travel. We've seen past experience was one of our biggest surges was right after that holiday period. So we're going to need to begin the winter period carefully, see how it plays out. And after that and settles in, maybe, a few weeks, month into it, we'll have a much better feel whether we can lighten some of these restrictions. Because we know this virus does tend to accumulate in indoor spaces, which is why we've been so persistent about the benefit of masking in the indoor space versus the outdoor areas.
Yeah, and I'll add, we know that the masking is not convenient. Wearing the mask and trying to be the speaker in meetings, which I often am. It is uncomfortable and inconvenient, but it is safe. And that is the most important part of it. And so we are following the science. We are listening to Chip and Angela and our other health colleagues who are experts in this field to make sure that we are providing the best guidance, policies and advice around this. But we recognize that it's inconvenient. So please know that we are not sitting in our glass house doing this to you all. My desk is in an open space, so I know the pain, and so we are thinking about all of those things. And so now I'm going to be very happily sipping my water at my desk, but I am going to do it underneath my mask because I am she who worries about any particle in the world. But we're thinking through all of these things. And as Angela said, we really want to watch kind of how things look after we return from the curtailment and people traveling and all of that. And if things still look great, that'll be one more positive sign towards making those shifts. But if we're not ready yet, then we won't make those changes. So just know that we're keeping those things in mind.
All right, thank you, Terry. So Brian, this question is for you. Today we're talking a lot about just transitions and adjustments into transitioning back into how things used to be or new ways of being. And I'm just wondering, recognizing that we're hearing from staff concern about things like masking and rules about doors and all that. I'm wondering if you have just a couple quick tips of maybe you've come into work and you're feeling that anxiety welling up about these things. What might you suggest to a staff member who's like on site in that moment, needing to find a little bit of calm?
Yeah, great question, Hallie. I was thinking of this just as we were talking about student needs. Students, of course, are going through a lot of adjustments and changes, and our staff and employee community throughout the campus is facing the same. And I think, first of all, it's always important for us just to stay mindful of everybody's context, and that all of us are facing stressors and challenges and fighting battles in our personal lives, family lives, and our working lives, and in making our efforts to navigate changes and losses and adjustments. And so I think just staying conscientious of that is a good starting point. Being mindful just about how we interact with each other, how we keep grace for one another, how we are being supportive of this as a community. And I think if that is a good starting point that we can begin with, then how we navigate all the uncertain moments is probably going to be a lot easier. So I would encourage that, and also encourage communication, right? Clarifying expectations, asking the uncomfortable questions is important too. If you have a question in your team or your unit, likely others have that same question. And I know managers and supervisors are working hard at trying to foster a climate and an atmosphere that is trusting and inclusive and supportive of everybody. And with that is also a willingness to have open communication about concerns, and of course, being thoughtful and supportive in how we engage in those concerns. So those would be some starting points I would offer, but FSAP is a good front door to go through if you've got personal concerns that might be more acute, the anxiety and stress that you're dealing with. Please know that we're here for you. And if we can't be that support that you need, we can certainly point you in a direction to connect with somebody who can.
Thank you, Brian. Sage advice and a good reminder of the resources that are available to staff. So we're closing in on 3 p.m. So I'm going to have this last question go over to Chip. It's something, it's a question that we saw come in many times. So Chip, do you anticipate booster shots will be made available to employees younger than 65 before the end of this calendar year?
People who work in higher education are exposed to students can get booster shots now. The general population, and that would, you could argue, would include people who aren't exposed to students in unvaccinatable populations, will likely have vaccines authorized in the next several months. The advisory board has been looking at reinfection rates, and I think as we see more and more of the rounds of vaccinees that receive vaccines back in April and May beginning to have reinfection, they'll say, oh, gee, we should probably get those folks boosted. Data are being gathered on those of us who are over 65 about the impact of the boosting on tamping down the breakthrough cases. And I think looking at the rate at which new breakthrough cases occur in people vaccinated 6 or 8 months ago and what the booster shots do for those of us who've been boosted will help make these scientific decisions about the right timing. We're all going to need boosters, no question about it. It's just a matter of timing. And as I said earlier, if you receive the J&J shot, no matter what your age, you should be boosted now.
All right, good reminders. Thank you. All right, so before we wrap up, I just want to note one thing. We're seeing some questions coming into the chat regarding event and gathering policies after 10/31, noting that that was a date we had said before that the policies would run through 10/31. The Vice Chancellor of Student Affairs area special events are hard at work on getting those guidelines set. So if you asked that question in the chat today and we weren't able to answer it, just for full transparency, that is definitely top of mind and something that we'll provide updates with as those decisions are made. So with that, I'd like to thank all of our panelists for being here today. I think we covered a ton of different topics and really just a holistic look at UC San Diego from a staff perspective. So really appreciate all the different voices here today. Our next town hall will be the first week of December as our last town hall of the year. And you'll see that information in the closing slides. So with that, I hope you have a great rest of your day and we'll see you next time. Bye, y'all.